Hi friends, I am Dr. B.B. Rao of Usha Clinic and founder of the websites fewmedicaldoubts.blogspot.in and Dr. Raghava and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for medical knowledge to general people and for reference to medicos. Today I am going to discuss about the obsessive compulsive neurosis. Psychological problems are so prominent in the society that many problems are left unattended. In the milder form, most of the problems are treated by the general physicians. The psychiatry deals with three large groups. The major disorder, minor disorders and mental retardation. The major psychiatric illness of psychosis interferes with the patient's thinking, perception, feeling so profoundly that at times that what he says to his neighbors no longer makes sense to them and is regarded as insane. Minor disorder. This group deals with the patients with less gross disorders who remains in touch their surroundings. They suffer from psychoneurosis, personality disorders, psychosomatic illnesses, sexual deviations or addictions. Mental retardation. Mental subnormality is a congenital condition may start from birth or early age. Classification. In brief, they are divided into two groups, organic and functional. Organic psychosis. In organic brain syndrome, functioning of the brain is impaired by the physical lesions like trauma, tumor, infection, toxic effects or degenerative process. Delirium. The organic brain syndromes when acute are known as delirium. For example, a toxic confusional state occurring with brain trauma, cerebral anoxia, infection or intoxication with barbiturates, amphetamines or alcohol. Dementia. The chronic psychosis where an irreversible brain lesion has occurred are called dementia. The most common are ones associated with advancing age, atherosclerosis and senile psychosis. Mild dementia. The patient is forgetful, easily confused, irritable and emotional. More severe dementia causes disorientation, gross loss of memory and deterioration in personal habits. Functional psychosis. These are the major psychiatric illnesses occurring without brain disease or impairment, which so far have eluded all attempts at explanation in terms of physical and biochemical pathology. The most common forms are manic depressive psychosis. The principal symptom is a profound disturbance of the patient's mood and schizophrenia. The patient's thoughts become bizarre and strange so that he loses the contact with the fellows and surroundings. Psychoneurosis. There are three types: anxiety neurosis, hysterical neurosis and less common obsessive compulsive neurosis. Now we will discuss about obsessive compulsive neurosis. A compulsion is a similarity, insistent urge to perform or to repeat some act which the patient consciously repudiates as meaningless or troublesome. struggles to against the urge, but finds himself experiencing very acute anxiety, which is only allayed by his giving in and performing the compulsive act. Obsessive compulsive symptoms may occur as episodes of illness in otherwise normal individuals, aggravated during an episode of psychological illness. In this condition, the patient, though perfectly lucid and in contact with the environment, may be severely handicapped by the unrelenting pressure of his unwelcome thoughts and impulses. Etiology. It is found in children of parents having the same problem, but not confirmed that it is hereditary. Extrinsic factors are not expected to be the cause. Clinical features. Obsessions may be divided into ideas, impulses, phobias, and ruminations. Ideas. Ideas are thoughts, images, strings, or words and phrases which consistently recur to the patient despite his resistance to them. The patient also aware it is absurd. Impulses. Impulses are urges to some act like killing offspring, jumping under the train, laughing at sorrow, etc. Phobias. Fears of some act like killing with a knife, etc. He fills his mind with a natural thought lest obscenity should intrude. Ruminations. Ruminations comprise the practice of consistently turning over problems in the mind, seeking an answer to a question, religious scruples, or of this order. When the patient has repeatedly to examine and re-examine his consciousness, uncertain as to whether he has offended or not. These symptoms are often intermingled and of different intensity. Sometimes merely a nuisance, and sometimes they become so severe as to arrest all life activities. The patient may be unable to paint or complete washing hands, thus may become depressed. Diagnosis. Diagnosis is easier when it is according to the definition. Delusion and schizophrenic symptoms are to be differentiated. Treatment. The patient does not respond well to treatment, but the condition is self-limiting at its acute phase. The patient should be encouraged not to endeavor to overcome the obsession by willpower. He should be assured that his condition, known that his irrational absence or murderous thoughts are not indicative of his true nature. He is encouraged to avoid the irritating situations. The patient is advised to be busy with practical tasks which demand his attention. That's all about the obsessive compulsive neurosis, and in the next video I will discuss about some other disease. Thank you.